Welcome to the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.
Just a quick disclaimer that we had some video and Wi-Fi complications during this taping, so you may not see one or both of us during this interview on the screen, but rest assured the audio all sounds good. Thanks again for tuning in. Hey, it's Dr. Josh Luke here with the Health Wealth Podcast and Radio Show. Thanks for joining us. Welcome to the Health Wealth Nation. We're here to talk about healthcare affordability and reducing wasteful corporate spending on healthcare, and also how to save your family thousands on healthcare each year. We have guests from all across industry, healthcare industry, disrupting healthcare from HR, and today we have one of the most unique guests that we've ever had, and it's somebody that I came across in 2017, and it's been such an honor to work with her and get to know her and see how they're truly disrupting her organizations, are truly disrupting healthcare. And I want to introduce you to the CEO and co-founder of Wambi, Rebecca Metter.
Hi, thanks so much for having me, Josh. Appreciate it.
Yeah, and you definitely get the award for having the best backdrop of any guest ever, with beautiful woodland hills here in Southern California in the background. So we come from opposite ends of LA, not from opposite ends of the world. I'm in Orange County, just south of LA, for those of you who aren't familiar with Southern California. Woodland Hills is on the north side of LA. So Rebecca and I don't get to hang out as much as we'd like, but we talk weekly, and we talk about how to disrupt and improve healthcare. And Wambi and their sister company Care Postcard are organizations that I came across in my daily operations as somebody really trying to disrupt healthcare delivery and reduce spending for you. And what I love about Wambi is, let me just give you a brief history of my last few years as a hospital CEO. The Affordable Care Act introduced not just initiatives, but penalties for hospitals if patient satisfaction wasn't good. And that's a difficult proposition. And they had us CEOs jumping through hoops for years trying to figure stuff out. And the irony is you would just say, hey, why don't you just give good care and everybody's happy? Well, it's not that easy. Patients expect a lot when you're caring for, a full floor of sick patients. In any given instance, something unfortunate can happen. So keeping those patient satisfaction scores up is difficult. But what we learned just about the time that I was leaving the hospital CEO space was that there's a huge connection between employee satisfaction and well-being and patient satisfaction and well-being. And Wambi and Rebecca's company was one of the first to market to say, we have anecdotal evidence that will show you, that your employee satisfaction is just as important as your patient satisfaction. But since there's an economic impact to every organization for both of those, employee retention and for patient satisfaction, Wambi came up with an awesome formula to help keep caretakers, nurses in particular, happy. And I wanted to ask Rebecca just to share that with you. Kind of give us a few minutes on the history of Wambi, how it came about, and how you guys are making a difference both in the hospital, and then we'll talk about how you can use Wambi at home as well.
Sure, absolutely. So Wambi was actually created in an acute setting by our inventor, my co-founder, Alex Corin, while she served as the director of patient experience. So what she observed very quickly on into her role there was that there was very high turnover among caregivers, and there was also pretty poor morale. And so she decided to really uncover what was it that was leading to that poor morale. And, what became evident after having many conversations and really saying, tell me about your story. What is it that's kind of causing this among you and your colleagues? They just said, we don't feel seen for the work that we do. It's one moment out of 100 that my manager might observe me, or there might be a proactive comment made, whether positive or negative, about me from one of my patients or families. But what about that those 99 other experiences of me providing great care to my patients? And really wanting an opportunity to be able to illuminate those other moments that clearly count, and to be able to be recognized for that, to have those sort of come to the surface. And so Alex created sort of a baby version of Wambi almost 2.5 years ago for that organization, and launched launched it there. And what WAMBI is it's a care provider recognition and performance system that's driven and powered by real-time patient satisfaction. So what that means is that there are other recognition systems out there that provide peer-to-peer feedback or employer to employee, so manager to employee, top-down management recognition. But there wasn't anything that was actually based in the voice of the patient. And really, we know in healthcare that that's what drives these individuals, these care providers that really come to work every day to care for patients. That's who they care about. That's who they want to help get better. And so creating a system that was fueled by the patient and family voice is something that's proven to be really impactful in the acute setting, as well as actually in other settings, including home care, which we've recently gone to market with. So it's been quite an amazing journey. We launched 2 other hospitals and health systems in January of this past year, meaning in 2017. We saw some unbelievable results. We actually just had a case study come out with one of our hospitals and saw some really amazing things on the CAPS side, improving CAPS between 6 and 10 points. So yes, that patient satisfaction survey can sort of have some nuances to it, but we've seen some really direct impacts there on the patient side to really make folks kind of drive that satisfaction. And on the employee side, really being able to improve engagement among employees by over 30% across the board. So really proud of some of the great results that are coming out of WAMBI in its installations.
So awesome stuff. So what I want to do, so a lot of our listeners in the Health Wealth Nation are employers that are trying to figure out how to spend less, particularly wasteful healthcare spending. But we also just have some individuals who are just enthusiastic about saying, gosh, I spend way too much on healthcare. In fact, every American does, so we can all relate to that. So let's just strip it back to the bare bones. So my mom is in the hospital, or I'm in the hospital. Tell me how I can spread the word or reward this nurse that's caring for me through WAMBI. Explain that process to me. It's through an iPad?
Sure. Sure, absolutely. So it's delivered in many different ways. It really depends on sort of the context of setting, but typically it can be delivered through an email or text from the organization itself. It can be delivered through a tablet or through a patient portal. And you would be able, as a patient, to be able, or family member, to provide feedback on an individual provider. And then that individual provider, although that feedback is completely anonymous, that provider is being empowered on a regular basis with general aggregate patient satisfaction analytics. So basically knowing, hey, I do a great job here, but here I might want to spend more time, and incentivizing them to continue to provide fantastic care and empowering them to really continue to drive to be the best provider that they can be. So as a patient, you would actually provide in the moment feedback on an individual provider.
So I'm in the hospital, and I have 3 nurses over 5 days, and I decide I want to give them all good feedback and say, hey, they were great. So how do they find out about that feedback, and what do they get in return for that?
So it depends on the organization, but each organization sort of incentivizes their care providers differently, whether it's a lunch with the chief nursing officer or whether it's a gift card to a local restaurant or movie tickets. The rewards vary on an organization by organization basis, but the way that the providers actually know how they're doing is they have their own gamified dashboard. So we leverage gamification in everything that we do with our providers to make sure that they're constantly feeling recognized and they get that ongoing positive feedback that they so deserve, and that is mostly based in the voice of the patient. So it's really being driven by patient and family feedback.
So if I'm running a hospital and I have a dashboard on my nurses station that kind of ranks the nurses based on the feedback, or at least ranks the top 10 ones, because we don't want to embarrass people, is that something you're seeing?
Well, we don't share sort of the comparison of how folks are doing to one another, to the actual providers. This is really about positivity, cheering each other on. We do honor those really amazing moments where someone really went above and beyond in their care and they got an amazing patient comment, or that person really went above and beyond for a colleague. So there are a lot of different ways that we sort of raise that recognition to the surface. And then from an organizational perspective, it is a great way to be able to say, oh, across all of our nurses, we see phenomenal treatment of respect for our patients, and we know they're wonderful at that. But potentially when it comes to explaining the treatment plan, maybe we could spend a little bit more time, or we could provide more support. So it is a great way to learn where there are opportunities for education.
Yeah, having run hospitals for almost 10 years, I would think if you and I were chatting about implementing this, I would actually want a board on the station that only rewarded maybe like the top 3 to 5. So we won't want to pick on people, but made it a little bit competitive to say, hey, we got a great comment, and flash the comment on the board, and also say this person's ranking highest this week. But it seems like, as I've gotten to know you, guys are so flexible on how the different entities and providers want to install it that, you guys you're pretty flexible with that, aren't you?
Oh, absolutely. Definitely. Yeah.
Cool. So, and this isn't just specific for nurses, right? It's all caretakers?
Yeah, it's interesting. Really nursing is at sort of the heart of what we do. They sort of began as the inspiration for the platform, but I will share that we see care providers of all sorts be on the platform. So whether that's, therapists or again, of course, nurses, or even physicians, or maybe even EVS workers, or other folks that, techs, or other people that have had interaction with patients or families, even those people are put on the system as well, because what that does is it really creates a culture or community within the care team or the extended care team for folks to be able to work together.
Gosh, you're getting me fired up. I have no interest in going back to be a hospital CEO, but if I did, I would want all my departments to be involved in Wombi, all my patient-facing and touching departments, so I could actually create some competition amongst them too to be the highest-ranking department. But that's ironic. So I'm gonna give you some of the most pulling back the curtain on the hospital industry here and telling you a little secret I learned about nurses in my 10 years. You know what they want more than anything when you give them a gift card or anything else? They want a second paycheck that you don't tell their husbands about. I can't tell you how many times they said, hey, if I work extra, can you give me a separate check so I don't have to tell my husband? I always thought that was funny, but I also thought that's against the law to do that with your bonus check. We have to do it in one. But what it did make me realize is they like those rewards, the gift cards to places that they can spend, particularly if it's a place their husband or spouse or a significant other doesn't have any interest in. But also even just cafeteria dollars, if there's a Starbucks next door or something. Wombi, correct me if I'm wrong, has the ability to really let the hospital choose what those rewards are, or the provider, because you guys do home-based care as well, right?
Exactly. Yeah. And I'll just share with you just that we have seen unbelievable results from organizations that don't use any monetary rewards as well. So like whether it's a parking space or, again, as I mentioned before, like a lunch with, someone in leadership, that's been a really hot ticket item or something like that. Those have been really sort of positive things, or maybe trying to get paid time off during a time that is typically hard to get coverage for.
Cool.
So there's lots of really cool ways to do it, very creative, and we're completely customizable when it comes to what rewards an organization wants to offer.
So this show's about healthcare affordability, and just so I can connect those dots for the Health Wealth Nation and those listening, so there's been a nurse shortage in America for years. When I was running hospitals, there was one of the biggest businesses was companies trying to sell me that I could hire nurses from Korea or the Philippines, wherever it was easiest to get a visa at the time, to come over. And there was a number of issues with that, particularly English not being the first language. But there was just such a shortage that retention remains regardless of the economy, nurse retention and caretaker retention is such a huge issue. And in the home-based space, that's totally true as well. Not even for nurses, but caretakers. So tell us how Wombi is helping with the retention issue for caretakers, both in the hospital and in home-based care.
Yeah, so I think that's a really important topic, Josh, that you brought up. And, it's interesting because what we know is that only 34% of healthcare employees are actually engaged on the job. So when you have a really low engagement rate like that, plus that millennials are coming up in this world in healthcare as well as sort of the global workforce at a really fast rate, and we know that millennials are actually 22% more likely to be disengaged than everybody else. we have a serious engagement problem on our hands in healthcare. And that leads to, all of these issues with retention and burnout. And it's costing us a fortune. And then we have this other issue, which you just shared, about not enough nurses being available, and the pools getting smaller from a recruitment perspective. So it's a huge challenge. And, it's interesting because although we started in hospitals and health systems, and clearly these are issues that are in those organizations as well, what we found when a home care organization approached us and said, hey, have you done this in home care? I really want to try it for my organization. And we tried it with them. What we learned is that across the board in home care, they're suffering from turnover rates that are way higher than in the hospital setting. And not only that, it's even harder for them to recruit caregivers or, care providers, depending if you're skilled or non-skilled. So, it's really a pervasive issue, and being able to solve that issue is something that I think a lot of folks are paying a lot of attention to now. And the way we approach it is by helping to improve engagement among employees through recognition and really driving folks to feel autonomous and to be able to have sort of power over, their own story, so they can know, how am I performing right now? How are my patients feeling about me? What are the things that I need to do in order to provide the best care possible? Because that's why folks go into healthcare, and really being able to kind of draw people back to their purpose, back to their heart, for the reasons why they went into this business in the first place, but simultaneously being able to engage and capture those millennials that are coming up in our organizations every day. So that's a bit about how we sort of look at this idea of engagement and trying to drive engagement across the board.
So you heard Rebecca say that it's costing us more money, and when you think about who us is, it's costing the hospital more every time they have turnover. It's costing the home-based care, whether it's home health or non-medical home care, more every time they have turnover. So WAMBI, what it really does is it improves retention, because let there be no doubt that those costs are passed on to the consumer. And nurses are one thing, it's competitive out there, but caretakers oftentimes making $15 an hour or less, oftentimes didn't go to college, may not be as responsible as somebody who is working for a hospital that's gone through the hiring process, fingerprint, all this other stuff. Sometimes these caretakers don't even show up for their third shift. They just decide they don't like the job, don't show up, and now the caretaker's really left kind of standing with the bag in their hand. What do I do now? And that drives costs up because there's additional recruitment. So all of these things are related to how much it costs you and I to access healthcare. So we heard about WAMBI. And Rebecca, I'd like you to share more now with the audience about Care Postcard and how it differs from WAMBI.
Sure, absolutely. So, one of the things that we realized through implementing WAMBI at our organizations was that WAMBI was creating and sort of housing some amazing stories and testimonials from patients or families about individual providers. And our mission at WAMBI is to be able to bring compassion to the forefront of human experience. And we look at that in a very global perspective, where it's not just about the patient and the provider, but it's about the patient, the provider, the manager, the administrator, the organization, as well as the entire community that our organization serves. So how do we really drive compassion there? And after realizing we were collecting these really amazing testimonials, we wanted to create a way for those testimonials to go out online and to become public, so that other folks in the community could actually look and find those amazing testimonials, which would give a wonderful way for those providers to be even better recognized out there, in the public eye, as well as for our organizations to get the word out there about the great work that they're doing. So we launched Care Postcard in July, and it's a wonderful way to write e-postcards of gratitude to individual providers, sharing those stories of amazing care experiences that you've had sort of in the past. And I'll share that part of this inspiration was also through my experience with with the nurses that helped me give birth to my son, and really being able to kind of have this way to thank them in a very public manner when I previously was able to, to just thank them one-on-one. And that was something that, we had between the two of us. But I really wanted other people to know about the amazing nurses who helped take care of me during that really impactful and precious time in my life. So it's a wonderful way to do that. And everyone can use it. It's on carepostcard.com. It's a open platform. And it really sort of charges this idea of bringing compassion to the forefront of experiences and really elevating kindness and serving it up in a way where other folks can read and can experience and then can learn from those moments.
So for the Health Wealth Nation who's listening, whether you're a patient in the hospital, whether you're getting care at home, a loved one, a grandmother, an aunt and uncle is getting cared for at home or in a nursing home, you can get in front of a computer tonight, right now if you're at home. You can go on to carepostcard.com and you can send a nice note to that individual. Do you need to have their email? How do we let them know that something nice was said?
Great question. So if you have their email, that's definitely best, because then we can actually notify them via email. Hey, a care postcard was written about you. Come and check it out here on the site. And what's great is that now that person can take that care postcard. They can share it on social media. They could link it to their organization's webpage. There's a lot of things that you can do with a care postcard. But you don't have to sign up with an account. It's a very open platform, and it really allows you to kind of share those positive experiences openly. And then we also have a tool on our system called Care Finder, which allows individuals like yourselves to be able to search for compassionate providers in your area.
That's so great. And so for those of you who are always thinking business, what I understand the difference here is Wambi is actually a business-to-business platform that's contracted by a provider that puts the opportunity in the consumer's hand to reward the nurse through thank yous. And so Care Postcard, kind of the next generation of Wambi, which is called Care Postcard, is what if a hospital or a nursing home or a home health agency hasn't engaged Wambi? Well, guess what? You can still go reward that nurse by just going to carepostcard.com. So guess what? If your next door neighbor is a nurse and you just admire how he or she gets up early every morning and still tends to all their things, you can. You don't have to be a patient. You can go on there and say, hey, this person is so great at what they do. I just wanted to reward them with a nice message. And so I really think both Wambi and Care Postcard are going to revolutionize just caretaker satisfaction and employee satisfaction. And so I'm really grateful, Rebecca, that you guys have done this. So tell us a little bit about what's next and where you see. You started in hospitals, then you started getting some interest from at least 1 or 2 nursing homes I know, and now home health. So tell us how you see the company continuing to grow.
Sure, absolutely. So I definitely see, hospitals and health systems being a major focus of ours as we sort of continue on in the market. I will share that home care is now a huge focus of ours. We see a lot of impact there, and it's especially difficult for them with a decentralized workforce and being able to create sort of a community culture, and that's something that we do really well. So it's a really nice fit for us in home care, and so that is a major focus for us in 2018. And going forward, definitely continuing to kind of bring our message and bring on new ways and creative ways to drive compassion in some of these sort of new ways we have, like Care Postcard, and being able to elevate that messaging. I will share that we see Wambi really being used in different ways depending upon the organizations, but a lot of folks have come to us and are starting to share, hey, we actually want a way now for our employees to provide feedback on their managers or on people that they work with in HR and things like that. So this platform is becoming sort of multifaceted, which is something that we're really excited about, and just providing folks with a voice, whether it's a patient or family member or it's a care provider, is something that we feel strongly about, and we know that that's going to only drive better experiences for everyone.
Yeah, and I really truly think the sky's the limit for Wambi and Care Postcard. It's such a disruptor. It's such a unique reward system for employee satisfaction and retention. And so, one thing I haven't done on the Health Wealth podcast and radio show before is talk about the National Readmission Prevention Collaborative, because that is a not-for-profit that my wife and I founded years ago, and we go out and we look for industry disruptors that are helping transform from what we call a heads and beds mentality in the hospital to a value-based care model where we're putting the focus on the patient. And Wambi is one of those 3 or 4 organizations that in the 5 or 6 years I've been doing that I actually reached out to them and said, hey, would love for you to kind of join our roadshow. And for those of you, I'm going to ramble off some cities here, because Wambi and Care Postcard, whether it's Rebecca or one of her colleagues, Alex or Tori, will be at pretty much all of these events. So I'm going to ramble off some cities, and you can go to the following website, nationalreadmissionprevention.com, and you'll see 12 events in 2018. I know those are 3 long words, but they're 3 words you know, so it's nationalreadmissionprevention.com. You're going to see events between April and October of this year in, Boston, Los Angeles, Dallas, Houston, Charlotte, Atlanta, St. Louis, Chicago, New York, and I'm missing San Francisco, and I think I missed 2 there. But
did you say LA?
Baltimore, and gosh, I didn't say LA, but I think I'm missing 1. So I think I covered most of them there. But if you're in any of those markets and you want to come hear more or learn more about care coordination, readmission prevention, employee satisfaction, nurse retention, how Wambi and Care Postcard have actually absolutely revolutionized gamification of caretaker satisfaction, come check it out. Rebecca, tell us where they can. You're on LinkedIn.
Yep.
As is your colleague Alex Coren, Coren, her co-founder and the inventor she mentioned. And are you on Twitter as well?
My team is, yes. I think we're on Twitter as well.
Okay, so I know the Wambi team is on Twitter, so you can find them there. And if not, just shoot me an email and I'll connect you with their Twitter handles. What are the websites for Wambi and Care Postcard?
So you can check out Wambi at wambi.org, and Care Postcard is just carepostcard.com. So care, C-A-R-E, and then postcard.com.
Awesome stuff. So I always end the show with this very important question. What is your favorite sports team to root for, whether college or pro?
Eagles!
Oh, wow. We're all on the bandwagon now. Are you from Philly?
I am originally from Philly.
Oh, cool. Awesome. Well,
yep.
On the bandwagon. She's been on the bandwagon for quite a while. So
I'm on the bandwagon.
Awesome. It's a good time to be a Philly fan. So join me in thanking Rebecca Metter, CEO of Wambi and co-founder, for joining the show. If you have any more questions, you can hit me up on LinkedIn, or you can shoot her a note at wambi.org. That's W-A-M as in Mary, B as in boy, I.org. So thanks so much, Rebecca, for joining the show today.
Thank you, Josh. Really appreciate it.
All right.
Thanks for tuning in to this episode of the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.